Qualified, professional, and compassionate doctors talking real solutions to real health problems.
On the DocTalk show today, our good doctors discuss depression, a condition so often ignored, especially here in Africa. The attitude is, you should be too strong to be depressed. Is it so? We find out.
Welcome to yet another episode of the DocTalk show, where today we discuss one of the gruesome and biggest public health problems, mental health. And we're discussing depression in the context of mental health. We have Dr. David Basangwa, the Executive Director of Butabika National Referral Hospital, mental hospital in Uganda, telling us about the gravity of the mental health problem in Uganda.
Mental illness is on the increase globally, not only in Uganda. We estimate that about 12 to 14% of the global population do suffer some form of mental health problems. When it comes to Uganda, we suffer quite a big chunk as well. Here we estimate that about 20% of our population do suffer various forms of mental health challenges. Of course, fortunately, not that all the 20% require treatment, but when you get down to seeing who requires treatment, probably about 10% of our population do suffer significant mental illness that requires treatment. One of the common causes for mental illness in our country is use of alcohol and drugs. Various people, young, old, but particularly young people, have taken up using alcohol and drugs. And these cause a lot of challenges to them. They cause mental health challenges, and they end up getting admitted to our institution. 20 to 30% of admissions at the institution are due to use of alcohol and drugs. People do get malaria and end up getting mental health problems. People get involved in accidents, especially where they hit their heads, for example, on the ground, and in future, subsequently, they develop mental health problems. Now, in terms of preventing mental illness, promoting mental health, it's really just about, first and foremost, educating people about good health, letting them know, prevent general health conditions, because as we prevent general health conditions, we also prevent mental illness. For instance, if we tell people to sleep under mosquito nets, if they don't get malaria, then they will also be preventing development of mental health problems. If we talk about taking children for immunization so that they don't get various other infections, then that will prevent them from getting mental illness. Reducing road traffic accidents, then we shall get fewer people with brain injuries, and therefore mental illness will also reduce. Loving carefully and faithfully so that people don't get HIV/AIDS. Stopping use of alcohol excessively and other drugs, that tends to be a little more specific. That's why we educate people that drinking alcohol excessively, using other addictive drugs is a bad thing, because with time that can lead to mental illness. We also talk about good parenting, good family living, because a lot of these also, like the psychological problems, some of result from domestic violence and other challenges that especially the young people go through in childhood, that predisposes them to developing various psychological problems in the future. Then about treatment, I think the good news is that mental illness, many of the problems that people develop can be treated. The only challenge we still face is that a lot of people out there do not believe that mental illness is treatable, and they keep our patients out there locked up in houses, tied on ropes, tied on chains, without bringing them forward to hospitals for treatment. Partly it's out of ignorance, partly it's out of stigma, and now we want to appeal to the public that mental illness is treatable. If you get anybody, a child, an adolescent, and a grown-up person showing signs, symptoms of mental illness, let them be taken to the nearest hospital. A person who is walking on a street with signs of mental illness is appealing to the public that take me to hospital, I'm not well. It's like a person that is on the roadside and is bleeding. So you can't see somebody who is bleeding and you just laugh at them or you throw stones at them. So we appeal to the public to support these people and assist them to get access to care so that they can also get well, they can be able to contribute to national development like any other person. The policy in our country is that mental illness is a part of the minimum health care package. That means that mental illness can be treated at any health facility in the country. Butavika exists as a national referral where treatment has failed at all the other levels. Treatment here at the National Referral Hospital is free of charge, and we encourage people to come in for care if they have people that have mental health problems.
You are watching the DocTalk Show.
Depression is one of the leading public health concerns globally. However, it is very poorly understood and as thus poorly managed. For this reason, it is estimated that by the year 2020, depression will be the second leading cause of global health burden. And we are talking of the second leading cause of health problems globally by 2020 if we continue at the rate at which we are operating. Today, at the DocTalk Show, we bring you two subject matter experts, Dr. Byama Mutamba, consultant psychiatrist at the Butavika National Referral Hospital, Mental Hospital, and Dr. Juliet Naku, senior consultant psychiatrist, still at the Butavika National Referral Hospital, and myself, your host, Dr. Fiona Tebwe, a vaccinologist and sexual and reproductive health specialist. Welcome to this show, Dr. Byama and Dr. Juliet.
Thank you.
Thank you. So, Dr. Juliet, we are talking about depression. We've said it is very poorly understood. People out there in the communities, when we say someone is depressed, or we hear people telling themselves, I'm depressed, I'm depressed. But to you as a psychiatrist, when we talk of depression, what do we mean?
Thank you, Fiona. Indeed, it's true that depression is a public health problem. It is a condition that is poorly understood, as you highlighted, and very poorly recognized. It's a mental disorder. It's a mental disorder that affects our mood. And by mood, we mean the way we feel about things, which causes us to react a certain way to our environment. So it affects our mood. Usually it makes our mood very low. It also affects our general interest in life and life activities. So those are the areas it mainly affects. Depression is not ordinary sadness. Very often people think that if I denied you a meal, for example, you'll be depressed. That's actually not what we mean. There's no more feeling normally sad about things happening around you. But with depression, this is a persistent problem of a sad mood and loss of interest in life and general activities because of something going on in the brain. So it is a mental disorder.
Okay, thank you very much, Juliet. And so you say it is a persistent state of sadness that is going on. And we know with the current happenings in our country, it is possible that people are persistently sad. How often do you find depression, or in society or in the clinics where you operate or in the communities, how common is depression?
Up to 3 to 4 out of 10 people, that is about 25 to 30% of the people who turn up there actually have depression, which is often unrecognized. Worldwide, it is believed that about 300 million people are suffering depression. It's about 5 to 10% of the general population. Very recently, we have done a study in one of the districts in eastern Uganda where we surveyed depression, and we found it to be about 7%. Now, that is about the same range or even higher than the prevalence of HIV
Thank you very much. To see that with the problems that we have, and we know that we have a big burden of HIV in Uganda, to see that we almost have the same burden of depression is such a big problem.
And Fiona, that is only in one district. When you go to some other districts, the rate may be even higher.
Wow, that is quite disturbing.
You are watching the DocTalk Show.